Namaskar. I am a 45-year middle-aged person. Growing up, we used to hear about ailments like high blood pressure only among old age people above 60, maybe even 70 years of age. And that happens because over a period of time, the fat gets deposited into the arteries of heart, and that causes the heart to pump the blood with more pressure, and hence the high blood pressure. However, nowadays, we hear about high blood pressure, hypertension, not just among old people, but also among middle age and even young age people. Ever wondered why? Two primary reasons for that. First is stress, tension. Chronic stress, overthinking, causes our sympathetic nervous system to believe that we are in some sort of danger. And when the nervous system believes that we are in danger, it causes the heart to pump the blood with more pressure. The second primary reason is sedentary lifestyle. Reduced mobility, like couch potatoes, working in office, sitting all the time, or even at home, eating junk food, frozen food, and less sleep. All of this actually weakens the muscles of the heart and causes the arteries to be in poor health, which once again puts pressure on the heart to pump the blood into the arteries with higher pressure. These situations are very common nowadays, but these can be addressed not just by medicine, but also by adopting subtle changes in your lifestyle. In today's video, we will demonstrate few yogic practices through integrated approach of yoga therapy, which you can adopt and address this condition holistically from physical to subtle to causal layer of your body. Before we begin the session today, we would like to remind you to subscribe to our channel, Aikyam Yoga and Wellness, and follow us on LinkedIn, Facebook, Instagram, and X to continue your rebirth and transformation journey. Before we begin the practices for hypertension, high blood pressure, just one thumb rule you should keep in mind. Any practice in which your head goes below the heart region, that must be avoided for patients with heart diseases or high blood pressure and hypertension. So anything where you're required to touch your head to the floor or inverted postures, please avoid. General thumb rule. Okay. So we'll begin. We'll begin with some loosening practices while sitting on the mat. We'll start with stretching our toes. Sit straight, Dandasana position. Breathe in, stretch your toes. Breathe out, bring them back. Breathe in, breathe out. Breathe in, breathe out. I can also show you the front view like this. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Last round, breathe in, breathe out. After doing 5 times, now we'll do ankle stretch. Breathe in, breathe out. Breathe in, breathe out. Let me show you the side view for this. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Last round, breathe in, breathe out. Okay. After ankle, we'll do leg stretch. For leg stretch, fold your right leg first, cross your fingers under your knees, fold the leg, breathe in, straight, breathe out, fold. Breathe in, breathe out. 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 And relax. Let's do the same thing with the left leg. Starting with folding posture. Breathe in, straight. Breathe out, fold. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Last round, breathe in and breathe out. Now we'll do a couple of breathing exercises. You can actually sit in cross-legged or Padmasan, Sukhasan, whatever you feel comfortable with. First we'll do hands in and out. Slow movement, not the fast. Stretch your arms in front of your body, palms facing each other. As you breathe in, spread your arms. Breathe out, bring them back. Breathe in, breathe out. Slow. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. After 5 rounds, relax. Now we'll do hand stretch. Cross your fingers. Put your hands on your chest. Slowly make a 90-degree angle as you breathe in between your arms and your upper body. Breathe out, back. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Now we'll make 135-degree angle. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Now we'll make 180-degree angle between arms and the body. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Go very slowly. Last round, breathe in, breathe out. Okay. Next, we'll do tiger breathing, also called cat-cow posture. For that, we will come on tabletop position. The gap between your legs is equal to 1 arm length, and then gap between your knees and palms is equal to 1 arm length and 1 palm length. As you breathe in, your stomach out, spine inward, gaze up, breathe out, back. Stomach in, spine curved out, and gaze on your navel. Breathe in, breathe out. 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 Breathe in. Last round, breathe out. Now, you may feel a little bit stretch on your neck, in your throat as well. Now, laying down, last loosening exercise, which is leg raise. For this, you keep your hands next to your body and we'll do alternate leg raise breathing. First, right leg. Breathe in up, breathe out, down. Now left leg, breathe in up, breathe out, down. Now right leg again, breathe in up, breathe out, down. Left leg again, breathe in up, breathe out, down. We'll do 5 times. Breathe in up, right leg, breathe out, down. Breathe in up, breathe out, down. Breathe in up, breathe out, down. Breathe in up, breathe out, down. Last round. Breathe in right leg up, breathe out, down. Breathe in left leg up, breathe out, down. Now we'll do 5 times both legs together. Okay. Breathe in up, breathe out, down. Breathe in up, breathe out, down. Make sure that when you bring your legs down, your head does not come up. Head should remain on the floor. Breathe in up, breathe out, down. Breathe in up, breathe out, down. Last round, breathe in up, breathe out, down. Okay. Now come up to sitting position. Get up from the side. We will do some asanas that will help open up your chest and the heart region so that any blockage or fat deposits in the arteries will get clear. We'll start with first asana, which is Vakrasana. For Vakrasana, we'll come to the Dandasana sitting position. I will show you the left side first. Fold your left leg. Your left foot should be next to your right knee. Knee up. Left hand behind your body. Right hand, bring it to the left side all the way to your left foot. If you're not able to reach up to here, if you can only reach here or here, that's okay. Try to turn your torso towards left side leg as much as possible. So, and try to hold your left leg wherever you can. Hold this posture, it opens up your chest, very good for kidneys. In fact, this is good for diabetes patients as well. Maintain this posture for 5 breaths. Normal breathing and turn your neck to the back. After 5 breaths, come back to the starting position. Now we'll repeat the same on the right side. Right leg folded, right foot next to the left knee, right hand back. Now left hand, turn to the right and hold it by your right foot. Turn your neck back, maintain this posture for 5 breaths. After 5 breaths, slowly release the hand and come back to your starting position as you relax. Next asana that we will do is Vikrita Gomukhasana, or the modified head of cow. It's a variation of head of cow, slightly less strenuous. So for that, let me show you the side view itself rather than the front view. So from the side view, starting with the Dandasana position, fold your right leg and bring it under your left leg, and fold your left leg, bring it on top of your right knee. Okay, and your hand, your left hand should be on top of your head, and your right hand is like making a hook between your hands and stretch towards the right side. Okay, you will feel the stretch here and open up your chest. Keep your spine straight. I can show you the front view also. Like this. 5 breaths. 1, 2, 5. After 5 breaths, release your hands. We will now do the other side. Left side below your right leg. Now right leg on top of your right or left leg. Now right hand comes above the head, left hand below, and stretch towards the left side. Maintain this posture for 5 breaths with normal breathing. After 5 breaths, release your hands, come back to the starting position. Next practice we will do is Bhujangasana, or also called Cobra pose. For that, we will come to the prone position, which is laying down on our stomach. Bring your feet or legs together, hands above your head. Slowly bring your hands under your shoulder, next to your heart region. And as you breathe in, slowly lift your upper body up to the point where your navel is touching the floor. Gaze up on the ceiling. And shoulder not like this, shoulders away from your ears. Maintain this posture for 5 breaths. After 5 breaths, as you exhale, slowly come down and relax. These were the practices that we did for the physical body, the loosening breathing as well as the asanas. Now we'll do one pranayam practice, which is called Nadi Shuddhi. It's a part of or a type of Anulom Vilom. For that, left hand, bring it in Chin Mudra, index finger and thumb together, 3 fingers straight, rest it on your left knee. Right hand, index and middle finger fold, and ring and small finger straight and thumb. We will open and close our right or left nostril with our thumb and these 2 fingers respectively. So first we will breathe in completely with both nostrils. Then gently block your right nostril and breathe out completely from your left nostril. Now breathe in from left. For the count of 5, you can count in your mind. Now gently block your left nostril, breathe out from right nostril for the count of 10. After 10 count, now breathe in from right for the count of 5. Gently block your right nostril, then exhale or breathe out from left nostril for the count of 10. So this completes one round of Nadi Shuddhi. We'll do 5 rounds. Breathe in for the count of 5. Breathe out for the count of 10 from right. Now breathe in from right, count of 5. Breathe out from left, count of 10. Breathe in. Breathe out from right, count of 10, remember. Breathe in right. Breathe out left. Breathe in left, count of 5. Breathe out right, count of 10. Breathe in right, count of 5. Breathe out left, count of 10. Last round, breathe in left. Breathe out right, count of 10. Breathe in right, count of 5. Breathe out left, count of 10. After 5 rounds, relax. Slowly open your eyes. Why we are doing breathe in count of 5 and breathe out count of 10 is because that way your ratio of inhalation and exhalation is 1:2. In exhalation needs to be longer than the inhalation when you do Navishudhi. If you don't have that much practice, you can also do the same count 5-5, and as you get more practice, you can increase the count for exhalation. Next practice that we will do is for our mind. It is Om chanting. It's a type of meditation. We'll do 5 rounds of Om chanting. It calms your mind and gives the breathing space to the mind. For Om chanting, bring both your hands in Chin Mudra. Once again, index finger and thumb together. 3 fingers straight. Rest your hands on knees. You can close your eyes. Spine straight, neck straight. Slowly breathe in from nose. And as you breathe out, do Om chanting. After 5 rounds, relax and slowly open your eyes. You may have observed that while doing Om chanting, I am spending more time on rather than O. That's the right way to do the Om chanting. You should spend more and more time on the humming and not necessarily on the O. Okay, I will have a separate video for the how to do a proper Om chanting, but for today this is good to follow. With this, we'd like to close our session today. We did practices for our physical body. We did practices for the pranic body, the breath, and we did practice for our mind, Om chanting. Before we close the session today, we'd like to remind you to subscribe to our YouTube channel, Aikyam Yoga and Wellness, and follow us on LinkedIn, Facebook, Instagram, and X to continue your rebirth and transformation journey. Namaskar.